Okay, guys, give me a couple seconds to set up for the show, and I'll be right with you, please. Okay. Let's take this down. These on my collar. Okay. Now for discussion A, we are going to discuss the connection between medical marijuana use and the risk of heart disease as a result. So here we go. The article discusses a new study that links marijuana use, whether smoked or consumed as gummies, to an increased risk of heart disease. Fox News senior medical analyst Dr. Mark Siegel appeared on Fox and Friends to detail the findings, which suggest that cannabis use negatively impacts vascular health. The study also explores how diet and exercise might help cancer patients. For a deeper dive into the study, you can check it out at msn.com, guys. Here, let me know if you'd like a summary of related research. Marijuana use, whether smoked or consumed as edibles, has been linked to several negative effects on heart health. Research suggests that chronic cannabis use can significantly impair blood vessels. Okay. Give me 1 second, guys. I have to even something out. Okay. Function similar to the effects seen in tobacco smokers. Some key findings include reduced vascular function. Marijuana use has been found to have roughly 50% lower vascular function to non-users, increasing the risk of heart attacks and hypertension. Blood vessel damage. Smoking marijuana has been associated with harmful changes in blood serum that negatively impacts endothelial cells, which line blood and lymphatic vessels. Increased heart rate and blood pressure. Cannabis can cause the heart to beat faster and raise blood pressure immediately after use, which may contribute to cardiovascular strain, folks. higher risk of heart attack and stroke. Studies indicate that frequent marijuana use is linked to an increased likelihood of heart attacks and strokes, with daily users facing 25% higher odds of heart attacks and 42% higher odds of stroke compared to non users. Increasingly, while both smoking and consuming edibles affects vascular function, they appear to do so through different mechanisms. Smoking marijuana seems to have more direct impact on blood serum composition, whereas THC ingestion affects vascular function in other ways. Would you like to explore ways to mitigate these risks or learn about alternative consumption methods? There are several. Ways to reduce the cardiovascular risk associated with marijuana use. Limit consumption, reducing frequency and quantity can help minimize vascular damage. Choose alternative methods. Avoid smoking as inhaling combusted materials harms blood vessels. Edibles may also pose risk, but future or further research is needed to determine safer options. Maintain a heart healthy lifestyle. Regular exercise, a balanced diet, and avoiding tobacco can help counteract some negative effects. Monitor blood pressure and heart rate. Cannabis can elevate both, so tracking these metrics can help identify potential uses or issues early. Consider supplements. Some studies suggest that compounds like ginseng, THC, induced inflammation found in soybeans may help mitigate THC reduced inflammation. Consult a healthcare professional. If you use cannabis regularly, discussing its impact with a doctor can help you make informed decisions. Would you like recommendations on heart healthy habits or alternative relaxation? Absolutely. If you're looking for ways to consume cannabis without smoking, are there are several alternatives that might be easier on your lungs while still delivering the desired effects. Here are some popular options. The edibles, these include gummies, chocolates, baked goods, and even infused drinks. Since THC metabolizes, let's see, differently when ingested, edibles tend to have longer lasting effects compared to smoking. Tinctures are liquid cannabis extracts that can be placed under the tongue for faster absorption in, into the bloodstream. They offer precise dosing and are discreet. Vaping. Vapors heat cannabis to a temperature just below combustion, allowing users to inhale vapors instead of smoking. This method may reduce exposure to harmful toxins. Topicals. Cannabis infused lotions, balms, and oils can be applied directly to the skin for localized relief. These products are generally not psychoactive, meaning they won't produce a high. Transdermal patches. These patches deliver cannabis through the skin into the bloodstream, offering a controlled and sustained release of effects. Cannabis infused beverages, from teas to sodas. Cannabis can be infused into drinks for alternative ways to consume it. Each method has its own advantages depending on your preference and health considerations. Would you like recommendations on which method might be best for your needs? Methods, yes. Combining different cannabis consumption methods can sometimes enhance or modify the effects to better suit individuals' needs. This approach, often called multi modal consumption, allows users to, give me 1 second, tailor their experience based on onset time, duration, and intensity. Here are some ways people combine methods: edibles and vaping. Eating cannabis infused edibles provides long lasting onset. This consumption can help maintain a steady experience. Uh, tinctures smoking, tinctures placed under the tongue provide fast acting effects, while smoking or vaping can add an immediate boost. Topicals and oral consumption. Using cannabis infused lotions or localized relief while consuming edibles or uh, tinctures can provide both internal and external benefits. But again, folks, like I said, it affects your heart health. So there is a drawback to that too. So for that, with that information, I will see everybody later for shows. For now, Gator Wellness, take care, folks.